Peripheral diabetic neuropathy or Prameha-Janya-PADASUPTI. An Ayurvedic and modern perspective with a case study. Peripheral diabetic neuropathy is one of the most common and disabling chronic complications of long-standing diabetes. It mainly affects the peripheral nerves, especially of the lower limbs, resulting in symptoms such as numbness, tingling, burning sensation, pain, and loss of protective sensation. In Ayurveda, this concept can be correlated with Prameha-Janya Padasupti, where Prameha leads to Dhatushay, Margavarna, and Vata Prakop, ultimately affecting Snayu and Nadi. This presentation aims to explain peripheral diabetic neuropathy from both modern medical science and Ayurvedic viewpoint. Peripheral diabetic neuropathy occurs in patients with long-standing diabetes, usually more than 10 to 15 years, and increases with poor glycemic control, advanced age, and duration of diabetes. It is a major cause of foot ulcers, non-healing wounds, infections, amputations. Thus, diabetic neuropathy significantly affects the quality of life and increases morbidity. Peripheral diabetic neuropathy in Ayurveda is considered as an upadrava of Prameha, predominantly due to Vat Prakop caused by Dhatushay and Margavarna. Ati Madura, Ati Snigdha, Ati Guru Ahar, Diva Swapna, Avyayam, Santarpana are the primary causes of the Prameha Nidan which lead to long-standing diabetes and later neuropathy. Long-standing diabetes for 20 to 30 years, Dhatushay, Vatvardaka Nidan, Ati Vyayam, Vegdharan, Shroto Dushti, Ojoshaya are the specific Nidan for neuropathy. Ati Madura, Ati Snigdha Ahar, Avyayam, Diva Swapna leads to Kapha and Meda Vriddhi, which then leads to Agni Mandya, then Ama Utpatti, Prameha Utpatti, long-standing diabetes, which then leads to Dhatushaya, especially of Meda, Mamsa and Majja. After Dhatushaya, Snayu Khandara Nadi Daurbalya is mostly seen, which is followed by Vata Prakop, Sroto Dushti, Nadi Dushti, Sthana Samshraya in Pada, Vyakti Padasupti, and finally leads to peripheral diabetic neuropathy. Case study. A 76-year-old female has diabetes for nearly 3 decades, presents permanent numbness of feet representing Prameha-Janya Vata Vyadhi with Majja Dhatushaya leading to Nitya Padasupti, which means irreversible sensory loss. History. The person used to consume excess sweet, curd, rice, bakery items which contained high calorie and low fibers, along with Snigdha and Guru Ahar. The patient also had a very sedentary life with lack of exercise. Stage 1. Early Prameha stage. At this time, Kapha Meda Vriddhi and Avarna of Vat begins. The symptoms likely faced by the patient were excessive urination, excessive thirst, fatigue even after mild work, slight heaviness in the body, increasing dryness of the skin, occasional tingling in the toes at night, feeling of cold feet, and mild pricking sensation once in a while. Stage 2. Dhatushaya begins. Here, Vata starts getting stronger due to Dhatu depletion. The symptoms faced here are increased tingling in the feet and legs, burning sensation in the soles, especially at night, pins and needles feeling, leg cramps, difficulty in standing for long time, slower wound healing, dry cracked heels, reduced warmth in the feet, heaviness in the legs after walking, and feeling of reduced sensation. Stage 3. Majjashaya along with Sira Shaitilya. Degeneration of Snayu, Sira and Majja increases. The patient experienced progressive loss of sensitivity in feet, reduced ability to feel cold, heat, pressure, rough surfaces, frequent stumbling or imbalance while walking, feeling that the feet are not a part of the body, coldness of the lower extremities, difficulty in judging the floor surface, loss of vibration sense, and the numbness becomes more persistent day by day, eventually leading to permanent Padasupti. The patient recently got a wound on the ventral aspect of her right foot. Due to the loss of sensation, she cannot feel the pain. These are a few pictures of the wound taken after a month. Even after 1 month, there is very slow or almost negligible healing.
This case demonstrates how long-standing prameha leads to progressive nerve damage. According to Ayurveda, prolonged kapha meda dushti ultimately causes vata prakop, resulting in padasupti. Peripheral diabetic neuropathy is a preventable but neglected complication of diabetes. Ayurveda offers a holistic understanding by explaining it as Prameha Janya Padasupti, emphasizing early intervention, lifestyle regulations, and Vata management. Timely diagnosis and integrated management can prevent severe complications like non-healing ulcers and amputation.